So thank you all for joining us. Welcome to the first session of 2023's Disabilities and Conditions of Aging Network. As I told some of the folks that were joining right at the beginning, this month I did not want to do a highlight or spotlight organization. I really just wanted us to have the opportunity to, again, introduce ourselves, but talk about any new initiatives for the year, any thoughts regarding this network and ways that it can be more effective and supportive. And so thank you for joining. Again, this network is hosted by Advocates Personal Care. If you are new, and maybe there are one or two new folks on here, I am Jeremy Warriner. I wear two hats. My organization is Walking Spirit, which is focused on accessible diversity, equity, inclusion, and belonging from a disability lens. So I'm available to provide that kind of consulting to any organization. Mostly I am focused on hospitality and really any business that touches folks in the public sector. So if I can be of any support to anybody through that role, please let me know. My other hat is as an outreach consultant with Advocates Personal Care. That's the other part of the business that keeps Walking Spirit going and doing outreach consulting. So Advocates Personal Care is a home health care company that is focused on attendant care, which is a service that allows us under the Medicaid waiver, specifically the aged and disabled Medicaid waiver, that allows Advocates Personal Care to pay family and community caregivers of people who are eligible for that waiver. Any questions about that, please let me know. The update on Walking Spirits side of it is that I am currently in the process of actually working with Voc Rehab to make my business plan more effective and to start working on that marketing plan to start reaching out to other organizations. Thank you, Krista. I see you're excited by that. She and I spoke about that a while back. So we are well into that process now. And then on Advocates Personal Care's side of things, we are in the process of expanding the counties that they serve. We've actually added Area 1 up in the northwest corner of the state. We're adding Area 5 just north of central Indiana. And we're adding Area 4, which is where Purdue University is, and the county's right around there. And we're also adding Areas 6 and 9, which are just east of central Indiana. So that's on the aged and disabled waiver. We also, at the very end of the year, literally New Year's Eve, I was working into the evening on finalizing our application or advocates application for to be a provider of services under the Medicaid waivers that are overseen by the Bureau of Developmental Disability Services. So Advocates is growing. We're trying to get to where we can help, folks with all sorts of different disabilities. So we're not restricted just to that aged and disabled waiver. So help that I could use from everybody on this network. If you know of any good connections where I can reach people who are eligible for those waiver services throughout the counties that we serve, please feel free to let me know. I don't know what I don't know. So any thoughts and ideas that anybody has, I would love to hear them. So that's mine. I'm just going to immediately go to Tamara. Is it right? Is it Ajamati? Is that the right pronunciation?
Yes, that's correct.
Okay. I'll let you take over.
It'll be brief and short. I have my son home with me. I attempted to leave this morning and my car is frozen. So my name is Tamara Ajamati and I am the social service coordinator with Easter Seals. And I am new within this role. So I basically work with all of the departments underneath the Easter Sales umbrella and also take incoming calls of individuals who are looking for services, as far as inquiring about being assessed to see if their child is autistic. We have assistive technology. So if someone calls in and if they can't see or if they're having vision issues, they can come in, have an assessment done, and see how the services that we have could assist them at home with being able to see better, and also rent out devices that will enable them to be able to see things in large print. But there's so many different gadgets that our assistive technology department has is super awesome. So if you all have the opportunity and the time, definitely come and take a tour of our department. But anyways, to make my long story short, I am the individual that receives all of the calls. So if anybody is inquiring about what we have to offer, or sometimes people are calling for rental assistance. So, I mean, anything, you name it. So I'm helping incoming phone calls as well as the clients that all of our departments basically serve. It's very nice to meet you all. And it would be great to also be able to send some of the inquiries that I have to you all if some of the individuals that I have are eligible for the services that you all have to offer. So I'll put my information in the chat.
Thank you.
Hey,
Yes.
Jeremy,
Yes.
I would like to piggyback off this because I want to do a shameless shout out to Brian Norton, who does all things assistive technology there and is so fantastic. And you guys have been.
I don't know what that was. Go ahead.
It was Miss Howard. Honey, you're not muted.
I'm sorry, my volume is all the way up, and I'm like, I can't hear anything. What's going on? I'm sorry.
Oh, you're all right. Hey, if that's the worst thing that happens today, we are in good shape. And so they have been a fantastic partner in hosting the new monthly Indianapolis Disability Talent Showcase meetings that we've partnered with putting together with the Work to Include Coalition. So those are the third Thursdays of the month from 1 to 2 p.m. at Easter Seals Crossroads in person or via Zoom virtually, to connect and network with local employers, direct service providers, and job seekers with disabilities. We had a fantastic kickoff last week with great employers, including, of course, Direct Employers Association and Recruit Rooster. The FBI was there. James Emmett and Company, Maximus. I mean, we had Disability Solutions were supposed to come. We had some other folks. Lily was there and others. So, you know, if you have job seekers with disabilities, if you are a job seeker with a disability or an employer or a provider, definitely encourage you to come to those. And then I'm going to put my email in the link to the ability site for the U.S. National Labor Exchange. We co-host that with the National Association of State Workforce Agencies. So you can utilize that to search jobs, internships, apprenticeships, engage employers. We do targeted job distribution for our member employers for service providers by the county that they serve as well. And we also have a partner relationship manager partner library that allows your organization to be searchable, findable, and engageable directly by our 1,000+ member employers. So we do a ton of cool stuff in the disability community between VR and the providers. Another shameless plug for Indiana APSE and the National APSE Conference coming up in June in Columbus. So that's my shtick. I'm not going to be able to stay the whole time because I have an APSE thing in Wisconsin that I have to go to, but please reach out and let's create more positive employment outcomes for people with disabilities and Hoosiers. All right.
Thank you, Krista. I'm thrilled that you joined us today.
I try. I came here first. So that tells you. I was like, sorry, cheeseheads, the Hoosiers come first. So,
well, and that was a perfect segue from Tamara talking about Easter Seals with what you guys are working on.
Yeah, so yeah, I had to give Brian all the kudos, and Chelsea and them. They're just fantastic to work with. And so we hope that all the other local providers and employers and job seekers, we had a gentleman actually that I connected with through is Jamie here with Special Needs Indiana Magazine. Is she on today?
I haven't seen, actually, she sent me a message that she wasn't going to be able to make it. So
we connected through this meeting.
Good.
I connected with a mother and her son, got them reconnected with VR. He attended the meeting, got to connect with employers in the tech industry, and fingers crossed that he gets a job from, being at that meeting this last week. So that's what it's all about.
Fantastic.
That's awesome.
Yeah, thank you. And that's something, and while we're on this and talking about ways that we can be more effective with this network, is the fourth Thursday of the month the right time for us to be meeting, or do we need to take another look at that so that people are hearing about what's going on before the month is over? Obviously, we can catch what's coming up in February, I guess, is what we should be talking about at this point. And when is February's next talent showcase?
That is going to be, again, it's a third Thursdays of the month. So that'll be February 16th, Thursday, February 16th.
16. Okay, very good.
Krista, do you have somewhere that you have a flyer or you have more information that would be easy to pass on to case managers? And we can even share it on our social media if I had more information. I think it's a great resource and I'd love to be able to share it out, but it's a little bit difficult just in the tidbit. So I don't know if you have something additional that you would be able to share with us.
Yes, and actually Pat Rogan at IUPUI, who co-leads the Work to Include initiative for Employment First in Indiana, is doing that. She has, I think I do have a flyer for the January meeting, but I didn't have one for that. But I'm going to go ahead and put her information in the chat as well, along with the Zoom. She'll send a calendar invite for those that are going to be attending. But yeah, I'll plug something in the chat, and then feel free to email me as well. Like I said, if you want to get those job leads from our local employers that are local to the counties that you're serving, if you want to be included in the partner library. I know Kendall and I had a meeting here recently, to get Noble included so that our employers can reach out to you directly. We'd love to have your involvement. So I'll put some more information in the chat, and then again, just email me. We'll set up a meeting and do all the things.
Very cool. I'm thrilled to hear that some connections are taking place. And so let's go right to Kendall so he can talk about Noble.
Yeah, perfect segue, Kendall.
Well done, smooth.
Did you win the Powerball, by the way? Because I'm banking on that.
I try not to check them for a while because until I check them, I have won.
That's nice. I like to think I'm walking around as a multimillionaire and don't know it yet.
Right, because as soon as you check them, the tickets are worth nothing. So I guess I'm going to pitch the cool new building we have coming up. The Career Center is getting closer, so you get a lot of my personal attention. But also with that, there are 9 apartments going in that building at 50 South Shelby that will be set aside for adults with intellectual disabilities. And you can choose a 1, 2, or 3 bedroom apartment. So we're starting to get the waiting list together for people interested in that. I do not have a price structure yet from the company, but it is going to be based on income. So it will be an opportunity to live. It'll be 50 South Shelby's right behind the Hardee's on Washington. Everybody seems to know that. So that's my big attention getter right now, is trying to make sure we get that opportunity to good people.
Very good. And I just saw a note in the chat from Tamara. You guys need to be in communication because she gets lots of calls about housing. So, all right, Kendall, anything else from Noble? Any big initiatives for the new year?
We're in the middle of rolling out a 2-gen project, but we're still in the fumbling kind of stage where we're planning and designing. So it's in its infancy, but it's an exciting way that we're working with families multi-generationally to try and work with parents of children with disabilities to build intergenerational wealth and stability. But that's still in, don't have a lot of talking points now because we're still in the really initial stages of that.
Okay,
But it's an exciting thing that will be happening over this year.
cool. We'll keep our eyes open on that. Courtney Hunt, would you like to talk about your different, the different hats that you wear? Because there's more than one.
Yes, hi everyone. My name is Courtney Hunt, and like Jeremy, I wear a couple of different hats. And so in my 9 to 5, I am a service coordinator at a HUD retirement home here in Indianapolis. They're independent living. And so my role is to connect them to resources and also bring in education and wellness programs for them. So for this group, I'm definitely looking for people that are interested in coming out and provide a program for them. What is her name? Kaylin, she has came in and done one via Zoom fall prevention. So just anybody that's interested in do that, anything you think seniors would be beneficial for them to improve their quality of life, I'm always looking for presenters. And then in my nighttime life, I have my own business and it's called Ambassadors of Hope. And what we do is we provide a parenting education program free for the community to keep families from becoming involved with the Department of Child Services. And we also offer foster parent support group for foster parents. And then we also do professional development for anybody who is in the human service, social service, working with people field type of things. And so on that end, what I would really love for 2023, we are going to start a new program. It's called Life in Limbo. And what that is a foster care simulation program. So people will be able to choose whatever role they want to be, whether they want to be the foster parent, the child, or the bio parent. And then it's kind of like a play. They'll have a script and they'll act out, but this will give you the experience of what it's like to be in foster care from those different roles. And so what I would love is a space to be able to host that. My staff and myself will be fully trained here in February. And so we would hope to be able to host at least one before 2023 is out over with. So we would love a place. If anybody has a space they're willing to donate for us to do something like that, is greatly appreciated. Thank you.
Thanks. Courtney, are there lots of kids with disabilities in the foster care program? Or
Absolutely, all the time, you know, and as my support group, we sent out a survey for this year, like what topics would you guys be interested in? And of course, that was a huge topic that a lot of people are interested in. You know, they see a lot of kiddos with autism, ADHD. We have medically fragile babies that come into the system. So it's just a whole host of disabilities. And of course, we know that trauma also can impact behaviors as well. And so these foster parents definitely need some type of education and resources outside of DCS, especially if they end up adopting the kiddos, because it's like when they're involved with DCS, they have all these supports wrapped around them. And then when the case is closed out, it's like, oh my gosh, where did everybody go? So even making those connections with you all about like, okay, here's a place that can help you. Support groups about disabilities, you know, particular diagnoses is also beneficial for kids in foster cares and the family.
And are you just in Marion County or are you statewide?
I'm stationed in Marion County. However, my contract for my support groups is in Region 11, which is Madison, Hancock, Hamilton County. And then I have a contract for Region 14. So that's Johnson, Shelby, I think Bartholomew falls in there. So it's several clusters of counties that I have my contract with, that I'm working with those foster parents in those areas.
Okay, great. Thank you. Kristen Ludeker-Siebert, would you like to talk about Hamilton County's systems of care and also maybe the Youth and Family Alliance and other things?
Yes. I'm sitting here thinking, what should I talk about? So, you know, Jeremy, let me know. I am the Director of Coordination for Healthier Hamilton County Systems of Care. Some of you I know. Hi, Mary Jo. Some of you don't know me. The idea behind a systems of care is to make sure that there is a platform for all the different systems that work with all the people within our community. And I know that sounds really big, and it is. So we base our nonprofit on the 8 dimensions of health and wellness, and we try to ensure that our consortium, we have a consortium meeting once a month, and that our board of directors has a representative from each of those dimensions of wellness plus, right? So there's so many interactions. We do a lot of things I say we, I'm the only paid employee, but I have a board, so it's kind of we. But we do a lot of things. The idea behind it is to fill in the gaps and look at those things that aren't being met within our county, and then creating partnerships on how they can be met. In fact, when I'm done talking, I'm going to put a link, and if you all don't mind, I would love for you to go look at this. We are currently, through the Hamilton County Community Foundation, we're partnering with a whole bunch of other groups. We have this behavioral health collaborative being led by HCCF, and one of the work groups is looking at mapping gaps. We started thinking about mapping resources, and we realized that we're very, very resource rich in Hamilton County, first off. And number two, there are a lot of platforms that already kind of hold resources, but why are people still falling through the gaps? So we're coming at it from the other end. So what are the gaps? So we need to map those gaps. I will put that link in our chat when I'm done speaking. Jeremy had mentioned our Youth and Family Alliance. So our Youth and Family Alliance, honestly, is how we hear what's really going on, because we all day long can sit in meetings like this and talk about what we think is happening and talk about what we hear, but are we really getting the voices from the people who live the day-to-day, in my case, in Hamilton County? And actually, that's how I met Mary Jo. She was a part of the state level family and youth engagement team. So that initially, years ago, our Youth and Family Alliance kind of started under that model because we were under a grant all through DMHA. But we continue to have a Youth and Family Alliance so that we do know what's really happening in our schools, in our communities, and what are the worries, and what are things that people they don't know about, or they want to learn more about, or they don't know where to find out more about. So some of the things that we have presented, we did an event last March, actually, called Resources Young People Really Want, and the kids on the Youth and Family Alliance led that, and they said, we have all these resources, right, and we can go to our social worker in school, but what we really want to know about is, and they gave me a list of, I don't know, like 15 things. We didn't have time for 15 things, so we hit like the top 3, and we had a virtual presentation on, here are these top 3 things that the resources, the things that our kids really wanted to know that they're not learning about. Our Youth and Family Alliance meets once a month, and we just changed that to the first Wednesday of each month at 4 p.m. And every quarter, so what would that be? March, June. So every quarter, we try to have an event, like I had just mentioned, the Resources Young People Really Want. So the first 2 months of that quarter is kind of brainstorming and what do we want to do. And the second month will be the planning, and I kind of do behind the scenes stuff. And then the third month of that quarter, we do the event. This is open to any youth, any family member, any one in our community, because like I said, it's a place for us to hear the voices from the people who live here every day. One of the other things, actually 2 other things I wanted to mention. One of the things that I also help lead within our county is our Veteran Suicide Prevention Coalition. And we are linked with the Indiana VA. We're linked with the Federal Veterans Health Administration. We just had SAMHSA, who is the Substance Abuse and Mental Health Services Administration on the federal level under the Department of Health and Human Services. We had them out in December to help us create a strategic plan and put that into motion when it comes to how do we identify all the vets in our county, how do we link them to vet specific assistance, and then how do we continue within our community to make other connections for them, whether it be vet to vet, vet to community, community to vet, kind of keeping them linked in. It's a suicide prevention idea, but the real word we're looking at is prevention. How do we even get ahead of before that suicidal ideation starts? So we kind of hit the whole gamut, but right now we're really focusing on that prevention piece. And I think I forgot the other thing that I was going to talk about. I don't remember what it was. Jeremy, is there anything I'm missing? I know you come to my meeting, so you hear me talk like every month.
But I missed this month, I think. So,
That's okay.
so I would say if you remember what that is, just hop back in. So
Okay.
for the moment, I'm going to go to Mary Jo from the ARC and let her introduce herself. I think is this the first meeting that you've actually been on? You're muted. There you go.
Yes, it is, Jeremy. This is the first time I've been able to come. Right at the moment, I am on the advocacy team at the ARC of Indiana, and I work with people with disabilities and their families to help them, inform them of resources and possible interactions with other people that could help them and their families.
Wonderful. Any big initiatives going on at the ARC that you're moving towards for this year?
Right at the moment, we're really involved in the Medicaid storytelling piece. We are actually putting together stories, good, bad, and ugly, of people that have been served with Medicaid that have had good experiences, horrible experiences, or how things were resolved in there, so that they can do an entire study of all of these issues and the things, so that they can figure out where people are falling through, what's happening, and what it really looks like to be a person on Medicaid.
Interesting. Is that something, is there a link to that or something that you could share in the chat so folks could submit?
Actually, I could. Let me find it and I will get that for you.
Okay, very cool. And while I'm on it, some folks have been doing it. Please remember to put your info into the chat. I know Tamara and several others have asked a couple times for us to put together a Google sheet for you all to be able to communicate and stay in touch. And I need to work on that. Anybody who's really good at that, please feel free to point me in the right direction on getting it done, because I tend to, I'm not that great at technical stuff. It's something I know I can figure out, but I move on to whatever I have to work on. So yeah, anybody who wants to guide me on that, that'd be great. Mary Jo, if you're done, I want to move on to Jessica Garber from Connections Case Management.
Hi there. I am the marketing director here at Connections Case Management. We just celebrated our 8th anniversary this month. So we've been in business for 8 years now, providing Medicaid waiver case management. This past year, we added on 2 new waivers. So we serve the family support waiver, the community integration waiver, which is on the BEAD side, or the Bureau of Developmental Disability Services. And then we started serving the aged and disabled and the traumatic brain injury waivers this past year. So that is something new that we have been venturing out in. And it's kind of nice because I don't know how many people have heard, but starting in 2024, the A&D waiver is going to be transitioning over to the BEAD side, and it'll be under their umbrella instead of the aging division. So it's kind of a nice partnering that they're working on that transition right now. So I would assume most of the folks that are on this call, because I know a lot of you understand what the waivers provide. But for those of you that do not know, for the BEADS waivers, the individual has had to have an intellectual or developmental disability prior to age 22. And I was thinking, I believe it was Courtney that was talking about looking for services for children. So if you have foster parents, we a lot of times will get referrals from DCS of people that are looking for waiver services. We provide a lot of DCS case managers with information as well when they're trying to make that transition. So for even children, they just have to have a disability. That diagnosis, it could be autism, it'll be an intellectual disability, anything like that that qualifies them. And then the aging side is a little bit different. It is you have to have either be over 65 or you have to have a medical diagnosis that requires ongoing intervention. Like for example, for a child, it could be a G-tube feeding or something like that. So those are some of the things that qualifies them to be able to get that other waiver. We see people back and forth, bounce back between the A&D and the FSW waivers a lot, depending what their needs are and what they're needing. The only other thing I would tell you today, we received an IPP grant for the state of Indiana. And we received 2 of them actually, and one of them is specifically related to the resource fairs that we've been putting on this past year. We had 5 resource fairs in 2022. And our goal for 2023 is to do 9 resource fairs. We're going to hit all 8 BEADS districts, and 2 of them will be in area 5 because we did South and North last year. So we're going to continue that, but then we're going to hit all the rest of the BEADS districts. So last year we were in New Albany, Evansville, Terre Haute, Southside, Northside. And then our plan is, I actually just met some folks this week and we're doing a Lake County. And then we're going to hit the north end of like near Allen County, and then some on the east side. So we still have some planning to do, but we should be rolling out a lot of information about that pretty soon. We're just trying to finish up the second phase of our IPP application stuff. So I'm hoping that once we get all that taken care of, I can start rolling out information to different organizations. And I already have a few dates on the calendar, but I'm just keeping things kind of under wraps until I have all the details figured out. But I will be happy to share that on these calls to let everybody know when those resource fairs are. They have been very successful so far this past year and provided a lot of resources to a lot of individuals. It's very nice for people to be able to do one-stop shopping essentially at those events, and I've generally had about 50 plus vendors at each event. So
Thank you. I've been at a couple of those events. They're very well done. And one of the things that you do that others have, other events have not, is that you, and correct me if I'm wrong, you guys have actually put together kind of a bit of a raffle with it that and gets everybody to go to every vendor that they can and get them to mark their sheet for that. So that's been a neat way to get people to visit the different vendors. I really appreciate that.
yeah, we've really tried. It's kind of been a learning process for me. I never had put on a resource fair prior to, we did our first one in 2021, and then we did 5 last year. So it's been a learning process. So it's kind of a process of elimination, what works, what doesn't work. So we've kind of added pieces on. We really try to engage the community. We've had like touch a truck with the fire truck department or the fire department from each local area. We have a music therapist and a recreation therapist come in that do a more hands-on interactive activity. I actually just got a letter from one of our previous partners that was talking about our resource fairs. And she said, as a parent of a child with a disability herself, it's really nice to be able to go to something like that and have a time where it could be a fun time where you're getting information, but also being able to bring your child with you and engage them in activities, and it be kind of an outing that often parents with children with disabilities don't get to enjoy those types of things very often. So it was a really nice letter to read of her just kind of describing her experience as both a vendor, a partner, and a parent. So
good, very good. All right. So I got a message there, and there's way too much for me to read. So Kristen, you want to jump in on the topic that you remembered?
I will. We are planning as one of our youth worker cafes here in Hamilton County. We're partnering with Indiana Youth Institute and planning a youth voice panel. So what we're looking for are youth to be involved with the panel. So our goal is to kind of hit get everybody from all of our school systems / schools. So, you know, from Carmel, Noblesville, Fishers, Westfield Heights, Sheridan, and then including Guerin Catholic, University High School, and Options Charter School. And really my ask out is, does anybody know of any youth that could potentially, you know, would maybe want to be involved with this? If so, my email is in the chat. And I put in the next paragraph that the next question I always get is, what's the panel about? Honestly, the panel is about whatever the youth want it to be about. We're going to do a planning meeting with them ahead of time, and they're going to tell us what they want to get out into the community, what they want to say out into the community, and we're just going to guide our questions based on that. So we're going to ask them, what do you want to say? And then we'll create a question around that so that they get the opportunity to have their voice heard. So if you have any ideas on what youth, any youth that you know that go to any of the schools in Hamilton County at all, please feel free to email me. And then we can do like a warm hookup or, you know, email or something like that with that person.
Very cool. Thank you. All right. So Crystal Hagens, would you like to introduce yourself, talk about what's going on over there?
Good morning, everyone. I'm Crystal Hagens, and I am the Executive Director for Epilepsy Foundation Indiana. I also am the Executive Director for Epilepsy Foundation Ohio, so I go between the two states. But with the foundation in Indiana, we offer seizure first aid trainings for the community, for families, caregivers, anyone who has a child or a loved one that has epilepsy or seizures. We offer that seizure first aid training. You can do it in two ways. You can do it just a training just to be knowledgeable, or you can also get a certification that works like first aid CPR, and you'll get certified in seizure first aid training for 2 years. We also do it for school nurses and school personnel. We also offer resources for people who may be their first time being diagnosed with epilepsy, or their loved one being the first time. So we send them packets that say, just gives them all the resources. It talks about seizure action plans and things like that. SUDEP, which is sudden unexpected death due to epilepsy. So we have information about that. We connect them with our virtual support groups, so that they can learn. We do it for adults, teens, and we also do it for parent and caregivers to have that support group, and they get to meet people from all over that are living in that same lifestyle. What else do we do? We do a lot, but and so one of our initiatives this year, well, of course, is every year we do the Walk to End Epilepsy. This year it will be in Butler. It will be at Butler University. So we are looking for organizations that would like to have a table there to talk about your organization. So we are looking for that. You can email me. I did put my email in the chat where I can send you the vendor or the organization form. It is free for nonprofits, so don't worry about a vendor fee. We really just want to have resources for everyone out there to be able to connect with one another through that. And then we're also, this year, we're really trying to get more outside. We do a lot more in Indianapolis, but we cover the whole state of Indiana. So we're really trying to get out into the Northwest part to give out some more information and be a resource in that area as well. So we're going to do Maryville and the South Bend area we're going to do Maryville in May, and then we're going to do like a back to school information session. Like, what do you need to know for your child to go back to school who has epilepsy or seizures, things like that. And there are a couple other initiatives that we'll do virtually where we're talking about transitioning. What does it look like transitioning from the doctor at 16 to now 18? What is it transitioning from high school to college or high school to work, those types of things, that give them information like that as well.
Okay, great. I don't see anybody on here from accessibility today, but that hopefully you were in touch.
I talked to them yesterday, as a matter of fact.
Very good. Awesome. Ruth Roberts, would you like to talk?
Hi, I'm Ruth Roberts. I'm with Specialized Home Care Services, and we're a waiver provider, and we specialize in home modifications and equipment. But our main focus is like sensory type of equipment. The owner of our company, Jackie Bodwell, has a daughter who has developmental disabilities, and she saw a need. The waiver will pay for things like weighted blankets and sensory equipment to help individuals with sensory issues, behaviors, that kind of thing. But there weren't any providers that would provide it through the waiver. So she saw a need and created Specialized Home Care Services. And now we get to help anyone on any of the waivers. It's awesome. Parents will call and they just don't know what they need for their child, but they will talk through it with me, what kinds of things they're experiencing, and we can kind of bounce ideas off. We really enjoy going to the resource fairs. We take a lot of the sensory items with us, so it's kind of they get to touch and play and see what they like. And it's funny, somebody might touch one item and it has a negative impact, and somebody else will touch it and want to take it home with them. So it's nice for people to be able to come to these fairs. So definitely I was listening anybody having any resource fairs, we'd love to come and bring our items just for people to see. And if anyone is on the waiver, everything that we bring, the waiver will pay for. So that's kind of helpful there.
Very good. And Ruth and I met at the
Yes.
course fair that I believe Connections was hosting up
Yep.
in Fishers or Noblesville, I think. So, yeah. Hannah, would you like to talk about what's going on with your world?
Yes, thanks, Jeremy. So I'm Hannah Osterlink. I'm the executive director for the Muscular Dystrophy Family Foundation, and we serve the entire state of Indiana. We are currently working on trying to reach more and more people in the state of Indiana. Every year we have more people say, oh, I've never heard of you before, and we've been around for quite a while. So we definitely want to try to reach more of the state. We have kind of the central part down mostly, but trying to expand. Just a little summary about a few of our programs. We do have something coming up. The application will open on March 1st. It's for our accessible van giveaway. And that's for anybody who has a form of muscular dystrophy. And we go by the National Muscular Dystrophy Association for all of their diagnoses. There are quite a few on the website, and I'll reach out if it's one of the more lesser known diagnoses just to make sure in case it is. But yes, anybody who has muscular dystrophy and who's in need of an accessible van can definitely apply. We're planning on giving away 3 this year. So that's the goal. We also have partial van assistance. So we have 3 applications right now in the wings for that already in January, which is great. So that just helps to bridge the gap between what the family can pay, any financing, and then we come along and help reduce the financing. And that's often in conjunction with the waiver. So definitely working alongside with waiver. And then the other thing is we do provide direct financial assistance. So if waiver or insurance won't cover a wheelchair or a seat elevator, that's where we come in, and we have a financial assistance committee that works those cases. So yeah, that's a little summary about the Muscular Dystrophy Family Foundation.
Very good. Thank you. All right. So next would be Julia DeLong.
Hi. Oh, excuse me. Hi, I'm from Socoa. I strictly do the Medicaid side of piece for Socoa, but Socoa as a whole does the aged and disabled waiver and the traumatic brain injury waiver for Marion County and the 7 surrounding counties. They have to come to us to get the waiver. So I probably see a lot of your clients. We also have case management here. And then other than that, we just do, we have additional resources that we can provide clients that, don't meet the needs for the waiver. So yeah, if you have any questions about Medicaid, I'm definitely your girl. And if you have any questions about SCOA, I can try to help you. Or I can definitely get you in touch with the right people. And I don't know what else you need me to share, but that's my spiel.
That's wonderful. Thank you, Julia. And one thing I want to throw out there for any case management organization, I know you guys cannot specifically refer a provider, that you have to provide a pick list and let your folks choose from that. But I do want to throw out there that if it would be beneficial for your case managers to have an opportunity to meet with me to talk about why advocates might be the company or the organization that somebody would want to choose, please feel free to let me know. I'm more than happy to do a special webinar specifically for your case managers so they have an opportunity to ask all their questions and are able to answer their clients' questions when they have them. So yeah, just throwing that out there. Let's see, Maria, would you like to talk about your organization?
Thank you, Jeremy. It's funny because I knew Julia's name and now I know why, because I've worked with her on a couple of cases and she is fabulous. She's just the girl that knows everything you need to know about Medicaid. I'm with the Alzheimer's Association. I'm a team social worker. I was fortunate I got to do my spiel a bit longer last month. So we run free care and support programs for anybody dealing with any type of dementia or anybody living in the sort of stage before a dementia was diagnosed, a mild cognitive impairment. So we have caregiver support groups across the state, but we have about, last count was 14 in the Metro Indy area. We run education programs. So who was it, Courtney, I'm definitely going to follow up with you, because we like to give education programs to the public. We just want to reach as many people as possible. And for the general public, we do a really neat program called the 10 warning signs. What's normal aging and what is something that's a little bit more concerning, and what you do in that situation. So that's a really neat program. Our big news for February, and February the 7th, we go down to the State House, and so this is an annual event, although we haven't done it in person since before COVID, where we paint the State House purple. That's our colours. Really raising awareness, concern and awareness about this disease and the resources that we have. But we also have a bill that we are supporting. We support all sorts of bills that will support seniors, but the bill that we're really pushing for at the moment is, I'm just looking at the number, House Bill 1422, and it's really about developing dementia sort of expertise in the state. And the plan is to have somebody overall as being the specialist on all things dementia for Indiana, but having a specialist in each of the area agencies across the state. So some of these bills, it takes a while, it can take a few years to get where we want to get to, but at the moment we've got quite a lot of support for the bill. And it sort of relates to the last couple of years the state's been working on a plan for Indiana, a state plan on for dementia, so it sort of ties in with that. So that's what we're up to.
Great. And that day at the State House again is what?
It's February the 7th.
February the 7th.
Anybody's welcome to, I'll put a link in the chat, anyone's welcome to be there and come and support the cause.
I'm assuming everybody will see where you all are, but is there a rally point?
It's on I think it's on the second floor. It will be where all the purple banners are.
Okay, very good.
But I'll put a link in if anyone wants to register. But it's a great feeling just to be there and really getting the word out there.
Wonderful. All right, Chalicia, would you like to talk about CareSource?
Yes, I would like to talk again. Yes. I want to apologize to everybody. My volume is all the way up, and I'm out here driving, and this snow has been hectic.
Oh.
And yeah, and I had an hour drive, and I'm driving in the snow, and I couldn't hear anything, and I'm like, my radio's turned all the way up. All I can hear is semis passing by. I'm fine now. Everything's good. So as long as everybody can hear me.
Yeah, we can hear you
are
fine.
great.
Thank you for joining us in that. I'm glad you're safe. All right, go ahead and tell us what's going on.
Yeah. Okay, so CareSource, for anybody who is unfamiliar, we are a statewide nonprofit health insurance company. And anybody who is familiar with Medicaid has likely heard of us because we are one of the Medicaid plan options, as well as a marketplace provider. However, what a lot of people don't know is that we do have Medicare Advantage plan offerings, as well as we do the dual S&P, the Medicaid, Medicare dual plans as well. So I'm available for any events or resource fairs that anyone would like us to come out and support. What I've noticed just in the last couple months in dealing with some of our members or being at certain community resource fairs, I've noticed that we've had an increase in Northeast and Far East Indianapolis of parents of children with special needs who are new to Indiana and are looking for resources. So I was like, oh, this is so great, because I just got tied in with Jeremy not too long ago. So I was like, I have resources for you all. I have numbers and names to tie you to. So that made me feel really good to be able to provide that information. So yeah, so I've been keeping in touch with a few of the families to find out, what are their needs and what is it that they're having access issues with accessing, because some of them in the states that they were in, they were fine, they were instantly tied to resources, but now being somewhere new, they're like, I don't know where to go, who to call. It seems like there's not too many people to help me. So I'm just happy to be a resource for those. And then CareSource covers a lot of services anyway, but it doesn't help for those to have additional needs met and to have, extra resources, because we're all a big resource family anyway. So it's like, let's just tie you to everything that you need, because we don't want to just meet somebody in one space and then, leave them with any other types of voids. So I like to find out what's needed and tie them to whomever. So anybody feel free. I did put my email in the chat. So if there are any events, resources, or if you just want to email me so that I can have you saved as a, reliable contact, to be able to pass to people when I'm attending some of these fairs, I would be more than happy to carry your information or flyers with me as well and have them present on my table.
All right, thank you. And Shalisa, please feel free to reach out to me anytime if I can point you in the right direction of other resources or help anybody who's looking for attendant care services. So Kristen, I saw a message from Jessica. I think that your email was bouncing back. So maybe verify that. I think there's supposed to be a K in front of your email, maybe. So there's that. We are losing folks. Tim, I'm going to introduce you in just a second. Before you do, one person who had to go was Kaylin Underhill, the health educator with Hamilton County Health Department. She listed her email. If anybody needs it, I can share that with you, or it's right there in the chat. And she said that if anyone is interested in any educational topics for your clients, patients, or whoever, to see the attachment below. And she posted a quick course fact sheet at both the beginning and the end of the chat. That apparently has some information about what courses they're doing, and feel free to reach out to her via email if you have any questions. She also said they've been fortunate to connect with Courtney and schedule several education topics and are always excited for new partnerships. I see Courtney smiling and nodding. Tim, would you like to round us out and finish up the hour by sharing about yourself and what you were involved in?
I just posted in the chat, for a person who's retired, I seem to spend a lot of time doing things. I should say I'm a retired professor, so this is something different, but I work for the 3 groups of the United Methodist Church, including the Indiana Disability Group, whose name changes every 2 months, and whose leadership changes every 2 months. We do have a Facebook page somewhere, which I couldn't find real quickly here. What I wanted to mention is I've been joining with United Spinal, which has some working groups on various concerns. One of which is keeping accessible parking spaces available for the people who need them, as well as getting them located properly, something that a few places haven't learned, and working on emergency preparedness for people with disabilities, especially in the light of what happened with the hurricanes in the past. And they're looking for people to join in with them, as well as publishing what they have on their website. And I have links to those in the chat.
Great. Thank you very much. That puts us right to the end of the hour. Does anybody have anything else that they want to throw in before we go away for the month? And again, that question is the 4th Thursday. It seems to be working for you guys. We're getting you here consistently. So just if that works, then we're probably going to be looking at the 4th Thursday of February for the next meeting, which I don't have that calendar right in front of me, but we'll make that work. Everybody good for the month? Okay. Thank you so much for joining me and all of us. And I look forward to hopefully seeing you in February. If you can't make it and you have somebody that you could send in your stead, please feel free to do so. So I look forward to seeing this grow. So thank you all very much.
Thank you.
Thanks.
Be well.
Thanks. Have a great one.
You too.